My name is Becky Slifkin. I'm Associate Chair in the Department of Health Policy, and I am here on the behalf of Dean Reimer and the faculty to welcome all of you to the Gillings School of Global Public Health. And we are really excited about this afternoon focusing on health reform and the future of health reform. We here at Gillings have a big stake in this topic. It's something that many of us are quite involved in. Our students are very involved in work with health reform. We have students who volunteer as certified application counselors. We have students who do their bachelor's papers, their master's thesis, and their dissertations looking at health reform, looking at the impact. We have executive students, both at the master's level and at the doctoral level, who are actively working in the field, many of whom have been involved in health reform as it was rolling out and still remain involved in some of the new models of care, like accountable care organizations. And we, as the faculty, and you're going to hear from these two folks here, but there's some other faculty in the room, also have been very involved in health reform. Some of us actually worked on it in Washington or in the state of North Carolina. We have faculty that are well known for the depth of their policy analysis, and they contribute to the policy dialogue. We have faculty who supply data and data analysis to people implementing the Affordable Care Act, people weighing different policy decisions. And we have faculty who have research grants to now study some of the new models of care that have come from health reform. So we are deeply, deeply invested in this topic. So we are delighted that that you guys have chosen us to do this afternoon, and we think it's going to be really thought-provoking, and we're glad that you're all here. So thank you for coming.
My name is Bill Arnone, and I'm the Chief Executive Officer of the National Academy of Social Insurance. I want to thank Becky and her team for letting us have access to this beautiful facility. I hope I don't get off to a bad start by telling you what I was doing Sunday evening. As many of you, I was riveted to the television, and I was rooting for Duke. Can I say that? And in a way, it was better. There's no distraction. You have no distraction now, right? There's no Final Four distraction. We'd have to compete with that. Really is great to be here. The National Academy of Social Insurance. How many of you have heard of the National Academy of Social Insurance? That's a higher percentage than... How many of you have heard of social insurance? Oh, that's much better. Okay, I feel really good. We're a 30-year-old organization based in Washington. We focus on 4 key policy areas: Social Security, Medicare, workers' compensation, and unemployment insurance. We like to take on the easy ones. As you know, they all have problems, they all have challenges, and our goal is to educate the American people and all stakeholders in the importance of social insurance to the American economy and our society. And as you know, it's very important to see students here. Every generation needs to reaffirm, A, its understanding of these programs. Why do we have programs like this? And B, its value to you. And to me, this is the most important thing of our work, is to reaching the future leaders of our country, make sure that you understand why we have these programs. And it breaks my heart when I talk to young people and they say, you know, Social Security is great for mom and dad, it's great for grandma and grandpa, but not for me. I'm not going to even think about relying on it at all. And once that starts to take root, that could be the beginning of the withering away of programs like this. Today's focus, though, is not on the income side of social insurance, it's on the health side. We're very, very excited to have a stellar panel you'll be hearing from to talk about one of the current challenges that we're facing as a country with the transformation of healthcare in so many different ways. Dean Reimer, I want to thank Dean Reimer for hosting us, the Gillings School staff. You'll be hearing from John Overlander, Pam Silverman, the Academy's VP for Policy, Ben Vecti, and Dana Thomas, as they'll be covering different aspects of healthcare. I want to thank Healthy Blue for being a key part of the sponsorship of the program. You'll hear from Chris Evans at our reception. All of you will stay for the reception following the forum. And our reception sponsors, Patterson Harkavy. I saw Hank over here. Hank, thank you for always coming through for the Academy. And the Sumwalt Law Firm also being a sponsor. And before I turn it over to Chris Evans, there are just a couple of things I'd like you to know about the Academy. One of the big annual events is in honor of the founding member of our Academy, a gentleman named Robert Ball. And Robert Ball was really, in many ways, the epitome of social insurance in the United States. He was the Social Security Commissioner under 4 presidents. You can imagine someone who was so credible and so nonpartisan that he was able to serve 4 presidents. And Bob was the guiding force behind the Academy. And every year we honor someone with the Robert M. Ball Award. And I'm thrilled that this year's honoree, Stuart Altman, is actually with us today. Stuart, if you wouldn't mind just standing up. And this is a legendary man. When we announced that we were giving him the Robert M. Ball Award, the most common reaction was, didn't we already give him the Robert M. Ball Award? It was long overdue. We're so thrilled that he'll be. So if any of you need a reason to be in Washington on June 27th, that's the gala honoring Stuart and Nancy Altman will also be honored that day. They're not related. We just happen to pick 2 people with the same last name, but that'll be an exciting event. The other point I'd like to make is one of the things the Academy really thrives on is developing future leaders, and we do that a number of different ways, including our internship program. And this year we're launching a new internship program in honor of a legendary health thought leader, Rashi Fine. I don't know if that's a name that any of you recognize. I don't know if you all recognize him. Rashi was really unique in what he did for healthcare, and we're having an internship launched this year. In his name, we'll have 2 interns, and I want to thank Ken Buffin, Ken from the Buffin Foundation, one of the early sponsors of the Rashi Fine internships program. So Ken, we're in deep debt for you. I know I see other Academy members. Those of you who are members of the Academy, just want to raise your hands. I see Catherine, Jason, Gina, Hank, Eric. I just want to thank you for being here. This is an attempt for us to take the Academy out of Washington and go to where our members are and where community leaders are. So it's very important that we're able to come to places like North Carolina. So without any further ado, also our Academy staff, Christine Quinio and Barbara Goldschmidt. You see this, Christine in the back. This is being live streamed, by the way. So everything, I guess the microphone system is on the ceiling. So any extra noise will be broadcast throughout the United States. I just wanted to tell you about that. But if during our question and answer session, if you're going to ask a question, we ask you to identify yourself and make sure that what you say ends in a question mark. And then we'll be able to get all of you in with questions. So without further ado, I'm going to ask Chris Evans to join us, and then we'll move on to the panel discussion. Chris?
Staying here. Good afternoon, everybody. Thank you. It's a pleasure and an honor to be here on behalf of Blue Cross and Blue Shield of North Carolina. As you can see, we're here to talk about the future of healthcare reform, and not to wane too philosophical. We are in the future of healthcare reform, and we don't have time to sit and wait and see what happens. We are in the thick of it, and it is up to each and every one of us to pay attention and to do something about it. So that is why it is so important to be able to have forums like this. So once again, thank you. Blue Cross and Blue Shield of North Carolina is a North Carolina not-for-profit. We have been in the state since 1933, serving 4 million North Carolinians this year alone. And we participate in all 100 counties in the state. Our mission in this state is to improve the health and well-being of all North Carolinians, not just our members, but of all North Carolinians. And with that in mind, we entered the ACA market at its inception and remain committed to providing health insurance and health care to North Carolinians and to individuals across the state in the future. Because of this, more North Carolinians have access to health care and are able to afford their health care today. However, along with that access has come an issue that more and more people are having a difficult time being able to afford their premiums with the rising costs of health care. And as a result, insurers, hospitals, and providers are working together at DC and here to help stabilize the market. You'll probably hear a little bit about that in the upcoming session. We're looking at trying to fund premium reductions, trying to fund cost sharing reductions, and also trying to fund the reinsurance program. But more needs to be done with respect to healthcare. We need to address healthcare costs together. And this means we need to stop paying for services as each service is provided, but we need to pay for quality and we need to pay for outcomes. We also need to rely on data and transparency to drive solutions because consumers can't win when they don't see the price tags, they don't see the quality information, and providers can't collaborate when they don't have that information as well. And finally, we need to face head-on the inexplicable rise in drug costs. That is something that as a company we are working toward and hoping to work collaboratively with others. And as Congress and then the executive branch search for solutions, states continue reforms on their own, which another piece you'll talk about today is the state's efforts to transform Medicaid from a fee-for-service model to a managed care model. And that is why we are here as Healthy Blue. Blue Cross is interested in transforming Medicaid as well, and we are planning on bidding on that opportunity in collaboration with Amerigroup, which Dana is here working with us. This collaboration brings Blue Cross's deep roots in the state, along with Amerigroup's experience across the country. They bring 26 years of experience in Medicaid, coordinating services and supports for more than 6.5 million members and other state-sponsored programs across 20 states. This includes 5.5 million members with behavioral health needs, 1 million members with unique health care needs, and 53,000 children, youth, and young adults. Healthy Blue will put our combined experience to work for Medicaid members in North Carolina. And just as Blue Cross embraced the opportunity to serve the North Carolinians with the ACA, we are embracing that opportunity to serve in the Medicaid market. We think that we're uniquely positioned to create the kind of change that can bring a more consumer-focused healthcare system to this state. We believe that with our collaborative efforts with providers, our focus on data and transparency, and our focus on social determinants of health, we can improve the health and well-being of all North Carolinians. And most importantly, we want to bring a renewed sense of urgency to the state to transforming healthcare across all lines of business. That's Medicare, that's private insurance, and that's Medicaid. And we believe that we are best positioned to do that, and although the need is particularly acute when it comes to Medicaid. Our state has a very long history of working together to address the most pressing problems that we face when providers, consumers, advocates, insurers, legislators, policymakers all come together. North Carolina has been the leader in this country on healthcare solutions, and we serve as a model throughout the nation. And that is why it is important to have dialogues like this, and that is why it is important for every one of you to participate in the solutions that we're going to talk about today. So once again, I appreciate being able to stand up here and being able to participate in this, and I appreciate seeing the discussion about to come along. And with that, John Overlander.